Thank you. All right, so I'm gonna ask the new members to briefly introduce themselves. We have a packed agenda, so we'll run through this pretty quickly and then we'll get on to our next order of business. Brittany, I see that you're present. Would you like to introduce yourself, please?
Hi, I'm Brittany Lassane. I'm excited to be part of the advisory board, and I'm the CEO of YWCA Clark County and live out in La Center, Washington.
Great. Thank you so much for being here. And Faye, would you like to introduce yourself briefly?
Sure. My name is Faye Solomon. I have a background in commercial property management and business management, and I'm pleased to have been chosen to be on this illustrious group.
Great, thank you. And is Clover here? Okay, I'm not hearing anything from Clover, so we'll move on. I'm not sure who's in the room. Abby, do you want to go ahead and do roll call, please?
Yeah, happy to. I'm just going to go down the list. So starting with Diana Perez, are you here?
I am here, present.
Great. Alicia Topper. You don't hear Alicia. Rob Perkins. Don't hear Rob either. Ernie Suggs.
Here.
Great. Joyce Cooper.
Joy here.
Great. Jamie Spinelli. Okay. Karen Kammeroff. Clover Spears. Megan Molsoff.
Good morning, I'm here.
Great. Faye Solomon.
I'm here.
Excellent. David just emailed me right before the meeting that he is out sick.
No.
Amy, yeah, okay. Great. Amy's in the room. Bridget McLean is absent and excused. Nakia Hunter. Melanie Green.
Here.
Brittany Lassine.
Here.
All right, so it looks like we have 8 members present. Oh, I actually see a couple more who just joined in. Jamie Spinelli, are you here?
I'm here.
Great. And Alicia Topper?
Yep, I'm here.
Excellent. So we have a quorum. To you, Melanie.
Great, thank you so much. Our first order of business is the approval of March minutes that were sent out earlier this week. Can I entertain a motion for approval?
This is Ernie. I move we accept the minutes that were presented.
Thank you, Ernie. I heard a first and a second.
Yeah, Amy was.
Thanks, Amy. Can we all vote to approve the March minutes for our meeting? All those in favor, say aye.
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 Hi.
Anyone opposed? Any discussion? All right, the March minutes were approved. Thank you so much. Our next order of business is the approval of the Clark County Community Services Strategic Plan and Mission Statement that was sent out as well. Can I entertain a motion?
I move to accept.
Thank you,
A
Faye.
second.
Thank you,
A
Ernie.
second.
All right, there is a motion on the floor to approve the Clark County Community Services Strategic Plan and Mission Statement. And all those in favor, say aye.
Aye.
Hi. Hi.
Any discussion? All right, the Clark County Community Services Strategic Plan and Mission Statement were approved. And Any other discussion about that needed? All right. Hearing none, we'll move on to the adoption of the Clark County Community Needs Assessment that was also sent out. I know there was a lot of work done to prepare this, work groups and the survey and a lot of data collected, and then focus groups amongst the community and a lot of review. Can I entertain a motion for approval?
This is Alicia. I move for approval.
Thank you, Alicia. Is there a second?
This is Megan. I second.
Thank you, Megan. There is a motion on the floor to approve, to adopt the Clark County Community Needs Assessment. Can I entertain a vote? All those in favor say aye.
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 Any opposed? All right, the CNA has been approved. Or the Clark County Community Services, oh, sorry. Yeah, this Community Needs Assessment, sorry. Any more information needed on the CNA? Or information?
Sorry, this is Jamie. I didn't get to buzz in quick enough. And not that I'm not, my question's about the strategic plan.
Oh, sorry about that.
I'm
Okay.
not opposed to passing it. My question was in the demographic breakdown, like the total percent there is like 111.4% if you add up all the percentages. And it looks like maybe that's because the Hispanic population, which was like 11.4%, is also included maybe in the white category. So I was just wondering if maybe there was a reason that it was, I don't know, broken down in that way instead of just having maybe Hispanic separate and not included in the white total, or maybe break or specifically like saying like 74 point whatever percentage white non-Hispanic, just to make it more clear is all I'm asking.
Thank you for asking, Jimmy. Good morning. Good morning, everyone. And really good. Oh, I'm sorry, Abby. Go ahead, please. My apologies. My apologies.
No, I was just gonna say that I'll let you take that question, Jackie.
Oh, wonderful. Thank you. Good morning once again, everyone. Yeah, Jimmy, good question. And yeah, just a delineation between that Hispanic individuals who are Hispanic sometimes fall within that sort of like racial category of being white. But then sort of like ethnically they are identified as being Hispanic. So you're 100% right. That extra 11% from folks who are classified as being racially white, but are are of Hispanic descent from a heritage perspective.
I appreciate that. I guess my question is, do you think it might be more, I don't know, to me it makes more sense to just have, whatever the total was, 74 point whatever's white, and then maybe below that add like 7.4% white non-Hispanic, and then 11.4% whatever that was.
Yeah, that makes a lot of sense. I think what you're saying is to avoid any sort of like confusion, right? So,
yeah, so that
yeah,
it
so
doesn't
maybe
have
just
a total of 111.4%. That way it just clearly equals 100, and it
okay.
makes sense that way.
Thank you, Jim.
Thanks.
Thank you. Any other questions or comments?
This is Diana, City of Vancouver. I agree with Jamie. If we're better able to give a good picture of the community, that would be great.
Thank you. Anything else? All right. Thank you so much, everyone.
This is Ernie.
Oh, go ahead, Ernie.
I just wanted to say that it looks like there was a lot of time and effort put into this report, and I want to thank you and the staff for putting this together that we could get out and read. So I know it takes a lot of time and effort to put these things together, but I appreciate that.
Thank you, Ernie. All right, I heard that we had some folks join us in the room. Thank you so much for being there. Can we have them identify themselves, please?
Morning, my name is Curtis Rogers. I'm with the Foundation, peer counselor.
Great, thank you so much for joining us.
I'm his wife, Alice. I support the foundation as well.
Thank you
Wonderful.
for being here.
Yeah, thank you so much.
I'm Letitia Flores, and I'm with the Salvation Army. I'm the family service manager.
Great, thank you all for being here.
Wonderful, welcome. Thank you for being here. All right, any other comments or questions before we move on? All right, thank you, everyone. Next, we have a presentation from Sue Neal with it's at the Battleground Healthcare Clinic. Thank you so much for being here.
So I'm not sure if Sue has joined us yet. She let me know that she might be a little bit late. So should we move on to another agenda item and come back to this presentation?
Yes, absolutely. Would we be ready for the finance team presentation?
Yes, I'm ready.
Okay, wonderful. Thanks so much for being flexible.
And this is Alyssa Page. I'm at DCS in the finance business unit. We normally don't go this soon, so I'm usually at the end of the meeting and it's like, you have 3 minutes to present. So
All right, well, welcome. Thanks, Alyssa. We'll turn it over to you.
yeah. And so this is our expense and revenue report, and the expense report is for the 6 months, July through December of 2023. And we do have some PDF printouts, and I'll just go over the reports, what we're looking at. They're going to look similar to the other meetings. So if you've been to the meetings before, you'll recognize these. If not, I'll go over them. And there's a lot of information. And if you do have any specific questions, you can always reach out after you have a chance to review the reports. You can reach out with an email if you have any specific questions about any of the programs or the spending or the funding. And is there any way, Abby, you could just make it a little bit bigger and then you can kind of scroll left and right as we go through and look at this report?
Yeah. Better?
Yes, thank you. So you'll see listed over in the orange, those are our providers, and this is going to be part of our annual report that we present in November as well. But this is the reporting period for 6 months, like I said before, July through December of 2023. You have the organization name and the program name and a description of what the provider is providing, the type of program. And across the top in the green is our funding sources that you'll see there. And in this portion of the expense report, these are all of our state, federal, local spending, non-COVID funds. Over in the blue, you'll see the total contracted amount for this fiscal period, the amount spent, and the percent spent. So we usually like to see about 50% spending or around 50% spending at this time since they're 6 months into their annual contract. And there are acronyms at the very end of the report that will show what these stand for CHG. MLF is like marriage license fee. HB is our house bills, which are the local document recording fees. So there is a legend at the end that will tell you what all the acronyms mean. And so after all of our, as we call them, regular non-COVID funds, Abby, if you can just kind of scroll down, and these are also grouped by the type of activity. So the first is the Community Action Program. And if you go on to the next section, there's data collection and planning. So we have all of those providers with the programs listed with spending, outreach, core support services, which are the CAAB reporting categories that we have. After the regular funding, we go into the COVID funding. And if you've been at one of the meetings before, there was a lot of COVID funding, and we're coming to kind of the end of our COVID funds. So the only funds that we have left, and I'm trying to draw out this conversation until we get to the COVID funded section. So there starts our COVID funded programs, and the only COVID funds that we have left that we were doing any spending on are the ARPA funds and the ESG-CV funds. And it's set up the same way, where you'll see the organization, the program, the spending. The only difference with our COVID expense report, if you can scroll over to the right, since these contracts run outside or a different spending period, you're going to see not only the spending during this 6 months, but the total spent on the contract and the percent of the total contract spent. Are there any general questions about this report or what you're looking at? I don't see any takers. Okay. So after the expense report, we have a revenue report. And the revenue report is sort of set up the same way. So we show all of our, it has the fund type there. So you see state, federal, or local. We do list our local funds for the 2 years worth of collections. We do collect a year in advance, and that so that we know how much money that we will have to put into contracts and then spend the following year. So for our fiscal year 24 that runs July 23 through June of 24, we are spending fiscal year 23 revenue. 100% of our funds are put into contracts. Any unspent funds, if allowed, are used to carry over and put into future contracts. So 100% of our funds are committed. And if you kind of can notice, I don't know if anybody's heard them talking about our document recording fee deficits that have been going on. As you can see, for like fiscal year 22 for House Bill 2060, we collected $745,000, but for fiscal year 23, $381,000. So our House Bill document recording fee revenue is down significantly, and the state has given us additional funds to help cover with our House Bill deficit so that we can continue the programs at 100% and hopefully not cut or decrease any of the funds on our programs. And down below, the state, federal, and local funds are the COVID funds that will be listed that we're using. So there should be, if you can go down just a little bit further, Abby, I think it's on page 3. So there's our COVID funds. So ARPA and ESG-CV are the only COVID funds that we currently have that we're still spending on. And there's some little notes there at the bottom that, like I stated before, House bills are collected at least 1 year prior to putting them into contracts, and our revenue is based on local, state, or fiscal years, which all run different dates. And 100% of the funds are committed in the 3-year RFA process. Are there any questions about the revenue reports? I see a hand up with the only few screens that I have.
Yes, I have a question. So how do you determine the amount that you're going to give them? Because I am also the rent roll coordinator for SHARE, and I also work for Salvation Army as a family service manager. And so I noticed that you guys have the SHARE $47 for the WHO shelter. Why is it so limited, and what are the criteria of what you disperse? And then my question is I see all these programs like for housing assistance, but I don't see anything for emergency, like for what we do at Salvation Army, which would be payment towards an eviction, so they would not be evicted. It's a one-time monthly annual fee that we provide for individuals. And so I'm just curious, I see like let's see here. A lot of like new friends, and then Giants Youth, but I don't have the Catholic Community Services, but like for the Salvation Army, like we do EFSP through the county, and so that's going to be preventative to get someone to help them not be evicted. from their permanent placement for housing. And so these could be individuals that were homeless and now they got into their own home. And so, and then I guess that's my final question.
Well, the providers go through the RFA process, so providers are picked that way. And the allowability is based on our funding sources. And I don't know of any of our state, federal, or local funds that cover mortgage assistance. It's mostly rental assistance and permanent supportive housing.
Yeah, it's
So-
not mortgages.
I can clarify that. So we do have quite a few eviction rental assistance programs. If you look in rental assistance under prevention, a lot of them are labeled EPRAP or EPRAP. And if you look at the bottom, you can see acronyms, just the whole thing. Right. That stands for Eviction Prevention Rental Assistance Program. So those are all eviction prevention.
Okay, so how would one apply for these funds? Because that's what we do at the Salvation Army. And so, I think that it's a really great program that we offer our community. And I would love to see it get additional funding because we have so many, within a 2-hour span, we spent, for just one day, $22,000 for, that was just 8 families. And yeah, so go ahead.
I'm sorry, Madam Chair. This is Alicia. Just a point of order. There's a lot of great questions being voiced right now, but for board members, usually we have a public comment at the end of our board meeting for the public to ask questions and give comments. And so I would like us to kind of stick to the agenda because it is very full today.
Okay.
Yes, thank you. Yeah, so we'll have time at the end where you can ask specific questions, but thank you for the rich discussion.
And if I can just to quickly answer your question, there's the RFP process that happens every year, and our next RFP is coming up in spring of 2025.
Great, thank you. Any additional information you want to provide with us, Lissa?
I think we're just going to the charts next to break out the funds, the expenses, and revenues from a little bit of a different lens. And so here is the expenses by funding source, and this is COVID funds that are in the orange color, and as I'm doing air quotes, regular funds that are in the teal color to show spending during that 6-month period. As you can see, the ARPA funds are by far the most that are being spent on right now.
Lisa,
And the next slide.
Sorry,
Sure.
Ernie's had his hand up, and then Jamie has her hand up. Ernie, would you like to
Thank you.
ask
I
a
can't
question,
see
please?
those.
Yeah.
Okay, well, I had a question on the previous slide in regards to the money that has not been expended. Is there a time limit on those funds that we have to expend in POP?
Yes, depending on the funding source, some state funds we have to spend in 1 year, some state funds we have to spend in 2 years, some federal funds can go from 1 year to 5 years. Our local funds can be carried over for any unspent funds. And we, like I said, commit 100% of those funds, but we are spending almost all of the funds. We try to spend out all of our funds within the time frame that we're given.
Thank you.
And we prioritize the funds that are ending to spend out before the funds that we have that we can carry over.
All right. Thank you.
Great. And Jamie, did you have a question?
I did. In regards to the ARPA funding on the prior slide that said it's to serve folks who are literally homeless, is there a breakdown on how much is required to be spent on those who are literally unsheltered, like are unsheltered versus homeless and sheltered or in transitional?
I don't know if there's a limit. Abby, do you have any information specifically on the ARPA funds about spending limitations?
I don't think there's a distinction on spending specifically for individuals who are sheltered versus unsheltered. But the way that the funds are allocated out into different programs would serve people in those different communities. So the ARPA funds are used to fund shelters, which would ideally serve people who were previously unsheltered. And there's also, Alyssa talked about a lot of the programs that we have, which are more for transitional housing or targeted prevention. So those would kind of naturally serve people in those different areas of need. Does that answer your question, Jamie?
It does. I just had I've had some conversations recently with the program with ARPA funding, and we had kind of a plan for hopefully utilizing those to transition some folks from shelter into housing, because they had to be spent out in a very short period of time, and it's a very small amount of assistance. So spending it on folks who likely had the ability to sustain after just a few months of rental assistance, it made sense to maybe target some folks in shelter, but then it turns out that was not possible. So you had to find folks who were unsheltered. And it seems to me like that might be problematic given the timeline.
Yeah, thank you, Jamie. I also see Joyce's hand is up.
Yes, was this spreadsheets sent out in an email before the meeting?
Yes, all of these were sent out in an email.
I missed it. Okay.
So I'll follow up with them as well.
This is Diana. I have a quick question on the ARPA funds. Can I ask?
Sure. Yeah, go ahead.
I see that it's expenditure of almost $4 million just from July to December. Is that correct?
Correct.
Okay. And what is that projection for when the ARPA funds run out? And does that mean that we would then have a gap of $4 million in the future? Or I'm just trying to understand the after.
Correct. Well, the
after
COVID
ARPA
funds were specifically for during the pandemic for additional assistance, and the providers were aware that it's temporary, not ongoing funding. So yes, that will, once the COVID funds are gone, we wouldn't have those additional funds to support those programs any longer.
Yeah, I guess I would be interested to see what gap that is going to present itself when the ARPA funds run out, in particular, rental assistance or shelter or unsheltered, some type of lumping in a thing, so we have a better sense for where ARPA was filling in a gap, and now we're going to find ourselves with another gap, just so that we could think ahead.
And if you look at the expense report, that'll break down which providers have been spending during the 6 months and the types of services that they were being spent on. So it would directly affect those types of programs.
Okay. So I'd have to go back and look at those spreadsheets. I'm not sure which ones they are. Were they emailed out? I apologize. It's a little too much in the weeds for me.
It's the expense reports. It was the one that had all of the programs listed by funding source and the providers with the spending to date. And there's a specific COVID section with an ARPA column that you can see where the ARPA funds were spent.
Okay, thank you.
I see Jamie has her hand up again.
Thank you. Yeah, just one more. Well, I guess it's a two-part question. One, if you had mentioned local funds can go back into the pot and be reallocated or used in the future, but that it sounds like is not true for ARPA. So if ARPA funds are not spent out by their deadline, what occurs to those?
We lose the funds if they're not spent out by the federal date that they need to be spent out by.
Okay. And then the second part of this question is, if some of those ARPA funds are currently allocated to a project and the limitation is more of a contract, like a county contract requirement, not a ARPA requirement, can contracts be amended if we feel like they're not going to be able to spend out the dollars so that they can spend them out effectively?
That would be a conversation to have with your program contact at the county if it would be allowable. I know we had to go before the council to be kind of specific on what we were going to utilize the ARPA funds for. So if it falls within that scope of work that was allowable for the portion of the ARPA funds that community services was given, that would be a conversation with your program coordinator that's overseeing that contract.
Well, it's not my contract, to be clear.
Well,
It's someone
the
else's.
contract, right? Whatever contract it is, they would need to speak with their program coordinator to see if it is an allowable activity for the funds that community services was given.
Thanks.
This is Rebecca, and I'll just add regarding the ARPA funds. We've been working very closely with all of the providers that have the ARPA funds to ensure that they're spending out their funds and that we will have all of those funds spent before the deadline of ARPA to have. So we don't have any concerns at this time that we will lose any ARPA funds because they are not being spent in the system as intended for the homeless crisis response system to expand services to support households because of the COVID pandemic.
Are there any other hands up?
I don't see any, Alyssa.
Okay, so if we can go to the next slide. And here is spending by service type. The majority is spent on shelter services and followed up by rent assistance. TH is transitional housing, PSH is permanent supportive housing. So this is just another view of how spending is done with the funds on the type of services. And next slide, please, Abby. And again, here's funding expended by service type, and this breaks out COVID versus regular funds, July to December of 2023. The type of services at the bottom, spending, and the COVID funds are the darker green color in the chart. And the next slide. And here's for a revenue chart that shows between our state, local, and federal funds, the amount of funding that we're getting based on the funder, whether it be federal, state, or local. And here is the comparison of funds received between regular allocations and COVID funding. And COVID funds run on their own sort of spending table than state, federal, or local funds. And this is broken down by the community action and COVID revenue sources. Is that the last slide, Abby, or is there any more?
Yes, that's the last slide.
Were there any final questions for the finance reports?
Yeah, this is Diana again. The last few slides on the pie chart, just kind of thinking about how different those pie charts would look without the ARPA funds and implications. As you can see, that's at the top of my mind. It's like, are we, other than just showing a picture of this is the funds and then, oops, it's gone away, so now here's the funds, but what is that? What is a strategy, I guess, to help with futuring or being proactive on these efforts and these fronts? Or what would we expect to see? In particular, as we just, approved the community needs assessment, there were a lot of assumptions on that needs assessment, a lot of things that weren't considered based on some previous discussions. So I'm just kind of trying to wrap my head around, and I say this because I sit on the ECHO, and there's clearly a link between the funding piece and how it impacts what we're thinking about. So I was just trying to get a better picture.
Right. I do communicate kind of regularly with Commerce about any gaps or deficits that we might have, and if there are any additional funds available that the state would be able to reallocate to our county. So there are regular conversations with Commerce regarding that. But as
Oh,
far
good.
as the ARPA COVID funds, yeah, once the time runs out with those funds, they're no longer available, and we do communicate with the state about our needs within the community.
So surely there's some type of, they're thinking ahead as far as how to come up with some way to fill in that gap, kind of like a next phase. I'm sure we're not the only ones in that same boat, but it's good to hear that you're having those conversations with Commerce. Have they said anything else about what to expect or could expect or what they're thinking about?
Nothing long-term projections. Commerce did just give us an additional about $4 million to help cover with the House bill deficit, so they are aware of the deficits and the shortage of funds across the state that we'll be using for this next fiscal year to continue the contracts at the same level. And some of those contracts are receiving the additional funds since their ARPA contracts are either coming to an end or being spent out. So we are taking those contracts and those providers into consideration when we do receive additional funds to prioritize where the monies are going for the needs of the community.
Oh, wonderful. That's good. That was the answer I was looking for. Thank you.
Okay.
Melanie, this is Alicia. I just have one last comment. I think for new board members, it's important to kind of conceptualize from a funding perspective that COVID, the infusion of federal funding into our homeless services system wasn't going to be an ongoing revenue source. And now that that timeline is running out for those funds and they're being spent down by our service providers, there isn't replacement funds to backfill the need. So the need is still there in our community, but the money from the feds is no longer going to be there. So we're kind of reverting back to our normal funding streams. And in that, we're seeing a shortage of funding in one of our core funds, which is that deed recording fee. So the state is responsible for approving the allocations of funding that come to the county. And that's why we work through the Department of Commerce, but we're not going to be at the same level. And I think all of us just have to kind of agree to that, and we need to lobby as volunteers in the CAAB, our legislators, to continue looking at the state budget in ways that they can make counties more sufficient in being able to provide services to people in need, because we've seen an increase in need, but now the money's going away to take care of it. So is that, you can correct me if I'm wrong, Alyssa, but I think it's important to know that COVID has never been an ongoing funding stream. It won't be in the future. That money's going to go away, but that we still have a need and we need to be able to advocate for additional funding.
Correct.
Thank you, Alicia. Thank you so much for bringing that up and a good explanation, because I think that really highlights our role on CAAB and a realistic picture of where we're really at.
Would it be good for us as CAAB to know where charitable organizations are spending their housing money, so we know where the need is if it's not being met by other organizations? That doesn't make sense to you, does it? Churches, and I'm using them because I know that, our church donated $22,000 to housing in March, in just that month. Would it help us to know where that money is going, where their benevolent fund is spending money? Because there's a lot of money, and will that help us determine where we should spend ours?
Hi, Faye. Thanks for your question. So we allocate funding more based on the needs that we identify, both in the community needs assessment and then also based on what providers apply for when they submit an application for funding. While that information probably would be helpful, we don't currently track that since it's a lot of data, comes from a lot of different sources, and it would be very challenging to track. So we allocate funding based on the needs that we identify and the applications that we receive.
Okay, great. Thank you.
And I think that wraps up the finance portion, unless there's other questions. I kind of saw a hand go up and then down. Is there any other questions?
Yeah, this is Ernie. In regards to the ARPA funds, from the city standpoint, I think you had to go back when they first came out, and we looked at it more as a bonus rather than a raise. in our
Exactly.
funding. And I think that that's important to realize that even though the bonuses provided us with more services, we knew they were temporary. But now that we've seen some of the issues that are brought up by that funding, now we have to be recreative and go out and find additional funds if we want them for that program, or we know that portion of that program is no longer going to be available, which we planned for. And I think it's very important to understand that, and appreciate the information that was provided for us on this report. I think it was very insightful and will help us further on down the road. Thank you.
And we definitely focus on funds that are use or lose and spending them by their lose deadline, so that we are utilizing the most of the funds that we receive, if not all of them, so that we continue to get funded at the same level and are able to support the providers in the community. Is there anything else?
Oh.
Oh.
All right. Thank you so much, Alyssa, for the information, and to everyone for the discussion. Appreciate that thoroughness. We're going to move back to Sue Neal with the Battleground Healthcare presentation. Thank you for being flexible and waiting while we jumped ahead to our agenda, but we'll get back to you, Sue.
Hey, good morning. Are you able to see me? Hello?
Your screen is black. Sorry. That's what I'm seeing. What about you, Abby?
Yeah, I can hear you, but I can't see a video.
Yeah, I don't know
I see a
why.
slide, background healthcare presentation slide. I could see.
I don't see, I see the slide. I can see you guys, but I can't see where you're seeing me at this point. But there's a picture of me in in my presentation. So I know we're short on time. Shall I just continue on?
That would be great. Thank you, Sue.
Okay. Let's see, let me just make sure if the camera integrated. Okay, well, I was trying to see if there was a setting with the camera. Well, I apologize for not being able to have all the technology there, but thank you ever so much. Many of you I've met or have had an opportunity to meet with some of you in the past, and some of you are new. Battleground Healthcare is just absolutely delighted to be able to be a recipient of funds to help bring healthcare services, particularly dental free healthcare services, to the community. So on the next slide, Abby, I think, is my picture. So since you can't see me, I look kind of like that still. My hair's a little shorter. Next slide. Battleground Healthcare, we are a free clinic serving Clark Kent, all of Clark County, Southwest Washington, and beyond. So we serve adults who are 18 and above. We do not have services for children. Our patients are the uninsured, underinsured, people who have exhausted their insurance coverage, might be in a gap situation, and up to 300% of the federal poverty level. All of our services are free. Next slide. So if you haven't seen us, we moved to a new location in August of 21, and we are on the corner of 503 and Eaton Way, just behind those flags of Welcome to Battleground. Our facility, we were able to expand by a capacity of about 58%. And we can offer multiple services concurrently. This was all a big effort in terms of COVID, in terms of being able to have a safe environment and spacing for patient care and services as well. So the main thing is that we are more accessible to our patients. We were tucked away and hidden before, and now we have high visibility. And then we also have some additional space that we had planned on for a future vaccine clinic. And we are just really, really privileged to have this space to serve the community. Next slide, please. Our services include medical, dental, physical rehab, health and lifestyle services. So underneath each of those categories, you can see all the different things that we provide. We are I like to describe our model of care as being integrated, comprehensive integrated services. So that means that everything that we do within Battleground Healthcare, we make available and to all of our clients, whether they're entering through medical, dental, physical rehab, or through the lifestyle. So we're making sure that we can have that comprehensive coverage for everyone. If you notice underneath medical, there's care management. So this is looking at people's social determinants of health, where the gaps are, and getting referrals and follow-up for everyone. And then talking specifically about dental today, so we'll go into that in more detail in the next slides. But that is our comprehensive services that you can see there. Next slide, Abby, please. So who we serve, I've mentioned that 18 and above and the low income at or below 300% of the federal poverty level. That 300% is significant because it allows us to provide access to services for a broader scope of people who find themselves suddenly without insurance or access to health care, new to the community, etc. But it's very helpful during the pandemic when there were so many changes in access to care. People are uninsured, they're underinsured, they've exhausted that insurance coverage, as I mentioned before. Some are Medicaid and Medicare patients who can't find a provider or access to services, and we can be that gap for a period of time. I really want to point out to you the slide, that the donut that shows where our patients live and where they're coming from. So 59% of our patients are coming from Vancouver. Many people think because we're located in North Clark County that we only serve North Clark County, or the majority of our patients would be coming from that area, which we really want to make clear that we serve all of Southwest Washington and beyond, and really taking a look at that large volume of patients that are really coming in from Vancouver. Next slide, please. 36% of our medical patients experience homelessness or housing insecurities in 2023. And this is significant for us to point out to everyone that so much money is going towards helping the homeless, and that there is a huge need for the homeless or people with housing insecurities to be able to access medical care and services as well. Next slide. So I want to focus on the dental, our new facility. So you can see a picture of, we were able to, in our new building, we gutted the west side of the building and we built out a 4-bay state-of-the-art dental clinic. And so this picture shows you the new chairs and some of the equipment that's there, and a bit of what the facility looks like. Next slide, please. We are able, in all of our new equipment, we have a digital CT scanner, and that's the picture that you're able to see there. And of course, we needed a sterilization room. And we had a panoramic scanner before, and we're able to upgrade, which is significant. So many of our patients have gone without dental services for years, maybe decades, and maybe never ever had dental services. We do have digital x-ray, as all of you have probably experienced, or many of you, when you go to the dentist and you get those bite wings with the digital x-ray, those are very uncomfortable. And we do those as we need, but we have this digital scanner that allows us to get a really good assessment of people's dental health. And this is not painful, and this makes a lot of difference. Next slide, please. Oh, goodness, that's hard for you to see there. So all of our services, I'm sorry that those showed up so small, but the very first band is screening. So in screenings, it's the same as if you go to any of your doctor, your dental dentist for a screening, except that we do a total medical as well as dental history, medications, blood pressures, and this is where that comprehensive and integrated care comes from. So we are managing hypertension, and we are able to really get a really good assessment of the individual's total health. Hygiene, that's that second band. Everyone needs hygiene. And then we have restorations. So restorations are where, we're doing the fillings. And I think it's easiest to say what we don't do is that we don't do crowns or root canals, but we do a lot of restorations. And the last one is extractions. Unfortunately, there are a lot of people who do need to have the extractions. The exciting thing that in June of 2022, we were able to start to provide some dentures. They are very expensive, and so it's limited, and we only have one provider who does this for us, but these make a significant change in our patients' quality of life. All of our visits are by appointment only. Next slide, please. I really want to point out to you about the dentures, the significance. So we did provide 11 patients with dentures in 22 and 20 patients in 2023. This is Bob, and you're going to get to see his video, the significant change in an individual's life. Bob came to us during the pandemic. He had fallen and injured his shoulder, and he needed surgery, and he couldn't have any surgery due to the health of his mouth. So we fixed his mouth, and he got his surgery. And then afterwards, that's that after picture, we were able to provide dentures. Next slide, please. So here's a picture of our dental staff. Everyone is part-time. Krista's our coordinator. We have a dental assistant, Maddie, and we have Dr. Joe Seppi as our dentist. And this was funding that was available. Being able to hire Dr. Seppi was in part very much due to your funding, and we are just thrilled to have him on staff. Next slide, please. We have a hybrid model, which means that we have paid staff and volunteers. Battleground Healthcare is predominantly all volunteer. Overall, in the organization, we have 220 active volunteers. In dental, the paid staff are the ones that you just saw earlier in the earlier slide. Our current volunteer staff just for dental is that we have 2 dental co-directors and 17 dentists, 7 hygienists, 17 dental assistants, 4 dental volunteers, and 52 dental students. That sounds like a lot. You're going to hear a little bit about why we have so many dental assistants and dental students as we come on to the next slide. But we are very dependent upon our volunteer staff to be able to provide our services. Next slide, please. So speaking of volunteers, we always need more volunteers, and We work with anyone's schedule, so this is a provider. And so when we're thinking of the providers, because we could provide more care and services if we have more of our licensed professional providers. So we do work with their schedule. We provide free malpractice insurance. There's no license renewal fees for active retired providers, and they don't have to do billing or insurance, which makes it very rewarding. So this is a quote from Dr. Pritchard. He has been with the organization for years, served on our board of directors as well. And his comment and his statement that I volunteer at Battleground Healthcare Dental Clinic because I can give back to my community that has been my home community for over 30 years. It's important to remember those in need. He is an amazing volunteer and echoes what most of our volunteers have to say as well. Next slide, please. One of the areas where funding went to was in our Salesforce data management. When we moved to the new facility, we identified that we had moved beyond being able to track our data by Excel spreadsheets. And so we invested in Salesforce. And what I want you to be able to see here is kind of there's so much data we can extract now and be able to provide to you and to other funders and to the community so they know the value of the services we're providing. So we tracked 1,240 dental visits in 2023 using Salesforce, and you can see by month kind of what those numbers look like. Next slide, please. We increased, it has been an amazing, as I mentioned earlier, our growth has just been amazing since moving to this facility. So we had a 200% increase in our dental visits since 2021, and you can see those numbers below. Next slide, please. As well as showing you the number of visits, here you get to see a breakdown in terms of the procedures and the value of their services. So if you look at the bottom of the chart on the left, in 2021, the number of procedures was 526 and a value of $97,241. And if you look at 2023, we had 1,603 procedures with a value of over $496,000. The need and access to dental services is huge and makes such an impact on the health of our community. Next slide, please. So building partnerships is a win-win. We have an agreement or contract with Area Agency on Aging to provide senior oral health. So for our seniors who are ages 60 and above, we are providing access to oral health care for them, providing all those services you saw earlier. And this is where those dentures really came into play, was with our seniors. Next slide, please. We have a very strong workforce development value here at Battleground Healthcare. As you can see, what we've mentioned here, we have Clark College dental hygiene students. So when you saw that large number of students, that makes up a lot of that student component. We work with Legacy Vancouver Clinic residency program. So we do have residents in the clinic. And we just will be working this summer with Cascadia Technical Academy for being a site for some training for their dental assistants. And then we have multiple different nursing programs and access. It is so difficult to find places and opportunities for our future workforce to have this experience, and we feel that that's one of the things that we can do here in this space. And also, it makes such an impact on being able to provide care and services in the community, but also for our future workforce to understand the value of caring for our people in the community who don't have access to care and being hopefully a future volunteer. Next slide, please. I would like to have, Abby, if you could just play Bob's story quickly. It's short, and I'd like to have you be able to hear Bob's story.
I don't know if the sound is. Let's see. Let me try to let it think really quick.
A lot of things I worked in the shipyard for a long time. Now, this is construction life, so building. Started doing that in high school. Doing carving and then my work, and then I progressed into doing cabinets.
Looked like we were getting close. I did see that there was another setting for my camera, so you might be able to see me now, waiting for Abby to see if she can get the video.
Right, can you all hear the video online?
No, not
Abby,
really.
did you ask me a question?
Can you hear the video online?
No.
It's really choppy,
okay.
what we
Yeah.
can hear. And now we're seeing everyone's name and video screen.
Let me try one more time, and if this doesn't work, then we might need to just get the video.
Battleground Healthcare saved my life. Yes, they did. As I know it.
Can you all hear the sound now?
Yes.
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 I've done a lot of things. I worked in the shipyards for a long time, and I've been doing construction my whole life, though, building. I mean, I started doing that in high school and doing carvings and inlay work, and then I progressed into doing cabinets and remodeling, and then I got into antique furniture repair, and then I retired shortly after that until my shoulder went buckle. So then after that, everything kind of fell apart. And I was walking out to get to my truck, and a guy was backing out of his parking spot, and he didn't even look, and he was going to run right into me, and I tried to step out of the way, and I tripped over my feet and fell on my shoulder. And it just dislocated it so bad to the point, ripped ligaments and tendons and all that, that Denise had to take me to the hospital that night, and they had to set it back in. I remember that vividly. Then after that, they scheduled me for surgery because of the COVID hit. I couldn't get in right away. And then when I did get into the pre-op, they told me I had to get my teeth done. And they sent me a list of places to contact, and Battleground Healthcare was one of them.
Battleground Healthcare is a nonprofit that provides free medical and dental services to the low-income individuals in Southwest Washington. Our clients are those who are uninsured, underinsured, and falling through the insurance gaps of today.
I got here, and that's when I hooked up with Krista and explained to her what the deal was, because I had some bad teeth. I didn't realize they were all that bad at the time.
Bob came to us about 1.5 years ago, and he came to us just wanting a medical clearance so he can get surgery. And as it turned out, he was unable to get that clearance because he had some issues going on in his mouth. And at the time, we didn't have any openings to get his dental work done.
She said to try to get me in, whenever they could in a spot. Well, they called me one time and I was in the shower or something. And Denise says, well, there's somebody here to see you. And I go, ooh. And so I answered the door, and I think it was one of the receptionists. They come to my door and said, hey, if you can be there in 20 minutes, we can get you in. And I go, yeah. So I couldn't believe they come to my door. I was just ecstatic.
Bob had to have surgery. His dental health was in disrepair, and it needed to be taken care of. It needed to be addressed. So when he came in, he had teeth that needed to be extracted because they were infected. He had gum disease that needed to be addressed. And so all that was taken care of. He was healthy, and then he was able to have his shoulder surgery.
Battleground Healthcare is funded really by the community. So it is our dedicated volunteers and their generosity in terms of providing their time and their talent that they give to us. Also, the individuals and corporate donors who participate and support our mission and our vision. And we have grants and community partnerships. All of these together help us to leverage our ability to provide services in the community.
I like that we give back to people. I like that we're able to make people smile. When I see a patient, I am able to tell them and help them without giving them a bill, without telling them this is the cost. You have to go home and decide if you can pay other things or if you can pay your dental bill. We don't have to talk about that. We can just help them.
After 3 or 4 weeks, I couldn't believe how good I felt. My jaw and my eyes and my ears stopped hurting, and I stopped having a fever and goosebumps, man. Yeah. I didn't realize teeth had that much to do with your health in your body, maintaining it. I mean, it just blew me away. After that, I had the surgery, and then I come in for, checkup or whatever, and then she says, well, I got a surprise for you. I go, what? We got somebody in that can actually do dentures now. I said, you're kidding.
And that is where Bob came in. He was one of our first denture patients. After his teeth were taken out, he had to heal. He saw our doctor, and we were able to get dentures for him. He smiles. He felt relieved. He felt back to normal, I think.
If Bob didn't find Battleground Healthcare and get his oral health addressed and made his mouth healthy, he wouldn't have been able to have surgery. And obviously that it would have affected the quality of his life and being able to chew, smile in pictures, and just feel better about himself.
And he was very, very grateful. So grateful that he does come back to volunteer. He loves to help with our maintenance, painting, fixing sinks, and hanging boards on the wall. Bob does a little bit of everything for us. He's that grateful.
Y'all saved my life, man. That's all I can say. I feel good, and I'm not in pain. I can eat anything I want. The fevers are gone away. My ears stop hurting. My neck stopped hurting. It's a wonderful thing.
He comes in knowing this is a place for him. This is his home too.
Through partnerships, we can build a healthy community together and not just take people from surviving, but thriving. Abby, thank you for making that video possible for everyone to see. This is just a glimpse of the changes, the impacts that we can have on the health of the total health of our community. We are grateful for the funding and for the support and for the partnerships. Love to have all of you come and take a tour anytime. You can just give me a call, send me an email, and we'll get you scheduled. But mostly, please let people know about the services of Battleground Healthcare. And you might be in the grocery line and hearing someone say they don't have access, can't find a doctor, and they don't have insurance. Let them know that we're here and give us a call. And again, many, many thanks for your support so that we can partner and to be able to work together to build a healthy community.
Thank you so much, Sue, for the presentation and the information. I love seeing the photos of the clinic and love that you involve dental students in your practice. That's amazing. So we're going to move on in effort time, but if you have questions, it looks like Sue's information was included in the presentation that will be shared out. So feel free to reach out to her, or you can email Abby questions and she can be in touch with Sue. So thank you so much for being here. Appreciate it. We're going to move on now to the City of Vancouver Affordable Housing and Homelessness Update.
Hi, I am Ann Hawkins. I am with the City of Vancouver Economic Prosperity and Housing. The applications for the city's 2024 Affordable Housing Fund opened on January 29th with a deadline of March 1st. The funding can be used for rental housing construction, acquisition, and preservation. AHF can also be used for home ownership assistance, rental assistance, and emergency shelter costs. Home ownership assistance can be used for households up to 80% AMI, and all other housing assistance must serve households at or below 50% of AMI. The city received requests for almost 3 times the amount of funding that was available. The scoring committee met March 28th and made the following recommendations. The award recommendations will be finalized after City Council review on May 6th. Next slide. The projects were scored and prioritized based on community need, project readiness, funding leverage, and project feasibility. The 5 projects above the line are high scoring and ready to begin construction in 2024. These are recommended for $6,095,000 in AHF funding. Smith Tower and Claudius Place are high scoring projects that plan to get under construction in 2025. These 2 projects are still pursuing other funding and need local commitment to help secure the other resources. They're recommended for $3 million for the 2025 AHF funding. There were 9 other applications in this category that were not recommended for funding at this time. Next slide, thank you. 3 homeownership applications were submitted. 2 were funded at half of their request based on funding available. Only 2 emergency shelter applications were received and both recommended for their full request. 4 rental assistance applications were received and 2 are recommended for funding. The Council for the Homeless request was for a 3-year program, and based on funding availability, 1 year of funding was recommended to start the program. Applicants that didn't receive funding can request feedback and technical assistance from the city on their project application. And that is the update for the Affordable Housing Fund.
Great, thank you. Are there any questions for Anne? All right, hearing none, we will move on to task force updates.
Hold on 1 second. I think I'm supposed to give my update on the other city stuff. That's okay.
So sorry.
That's okay. I wasn't at the last meeting, but I heard that Alicia had asked about the affordable housing sales tax, which I think is called other things, but it essentially came from House Bill 1590 back in 2019. It's a 0.1% sales tax, which is approved by Council Manic Authority, which was approved in the city back in 2020, I think. And so I know that Sam was asked last time, and I think she's not currently utilizing those dollars, and I am using some. So I wanted to share. First I'm going to share that it's a little difficult to break out by year. Alicia had asked for 2023. The reason it's challenging is because each of the services that we fund have different beginning and end dates throughout each year, because each of these sites opened at different times. But in general, I can tell you that this fund, the revenue was roughly $7.5 million for 2023. And that my department utilized about 3.6 million in 2023 to support all of our safe stays and our safe park. So that would be 5 sites, but 2 of those opened at the end of 2023. So sites 3 and 4 opened in November and December of 2023. So this assisted with standing up and initially supporting the operations of those two, and then the operations for our first two sites, which are Hope Village and the Outpost. And I can tell you that the total number of people served was 337 across all sites. The total house is going to look kind of low because we didn't house anybody in our last two sites in November and December when they first opened. So total housed was 90, and we moved 7 folks into more substantial shelter from Safe Park for 2023. But again, their contract cycles are all different. Anybody have any questions about that?
This is Alicia. Thank you so much for bringing this information, Jamie.
Sure.
So just to be clear, so these programs are not duplicative, so they're not affordable housing funds. These are specifically funded through the sales tax dollars. Is that correct?
Correct. The Affordable Housing Fund did fund the infrastructure costs for site prep for sites 1, for sure sites 1 and 2, and potentially some of 3 and 4. But these funds have only been used for operations.
Okay, because the only reason I asked is because the affordable homeownership piece for Proud Ground and Evergreen, I know that there is a set aside in the Affordable Housing Fund for homeownership. So I didn't know if this was in addition to those funds or if it's reporting kind of just the overall homeless services pot of money.
Well, so Sam does the Affordable Housing Fund.
Mm-hmm.
She oversees all of that. So I don't think I understand what you mean. None of these dollars are coming out of what's coming out of the affordable home ownership, if that's what you're asking about.
So the sales tax dollars?
Correct.
I guess it's because I haven't really seen, and maybe it's just because I missed it, and Diana may be able to correct me. I haven't seen like a homeless or housing plan that specifies the affordable housing / homelessness sales tax dollars. Like the administrative plan is really clear for the affordable housing fund of what the objectives and deliverables are going to be with that money. But when it comes to the sales tax dollars, it feels very loose and just from an outsider's perspective, almost as if the city just has a slush fund that they're going to use as needed, but not necessarily well strategic and, you know, pointed outcomes that you're trying to get out of those dollars.
Sure. I would be happy to follow up with finance about that because I don't oversee these funds. I just
Who does?
A portion of them are
Finance?
utilized. I would have to check with finance to figure out who is the owner of the fund. I just know that these were
Well,
the
the
funds that
county
were available.
council is responsible for these funds ultimately. And I guess I mean, and I'm only a member of the CAAB and, you know, I'm the treasurer, so I know how much is being collected in sales tax dollars for this purpose. And I just don't see an equal amount of funding being expended. So I'm just wondering, like, are you guys reserving a specific fund balance? And if so, is it being tied into the overall Clark County homeless services plan, or are you guys creating your own plan?
I don't know anything about creating our own plan beyond the plans that Sam has for housing and economic prosperity or economic prosperity and housing. I'm forever going to get that name wrong.
No worries. I guess I would just ask Diana as a council member then, like, I don't know if you guys have really talked about this funding source and what your overall objectives and priorities are, but it does, I mean, $7 million is no small amount of money. I mean, that's only $3 million less than the Affordable Housing Fund that you just received for property taxes from voters. So I guess this councilmatic option for funding is significant. And me personally, I'm very interested in seeing what it's going towards.
Alicia,
So that's
can
all.
you hear me?
And this does help, but thank you.
Can anybody hear me? This is Diana.
I can hear you. Hi, Diana.
Okay, sorry. I was trying to chime in. I just want to make sure I got your question there. Your question is there a strategic plan for the sales tax dollars? Correct?
Yeah, I know the
Affordable
council
housing
has to
plan. Okay.
approve the budget, so you have projected revenues coming into that fund. I'm just curious to see what the approved expenditures were that were, you know, this designated sales tax fund that's newer to the city. I mean, I guess it's almost 4 years old now, but you talk a lot about the Affordable Housing Fund and the work that is being done, and the deliverables are transparent. But for these dollars, I'm not seeing the same transparency or planning.
Gotcha. Okay. Yeah, I'd have to go back and talk to our city manager and see. It might be there and we're just not being, it's not promoted or shared enough. So we'll just have to dig back on that one and see. And if there isn't, then put one together, obviously.
All right, sounds like there's a conversation that can continue after this meeting because there's some follow-up questions. So thanks for bringing that to our attention. In the effort of time, I'm going to move forward with the task force updates. And if there's any questions, feel free to follow up with Jamie.
Melanie, if I could just ask, Alicia, can you send me an email with a clear question so that we can track it and not lose it?
Yeah, I can
I've got it.
forward what I sent Jamie, and I can expand on that if you need.
Okay, thank you.
Thanks.
Great, thank you. All right, Amy, do you have a legislative advocacy task force update for us?
The room is muted. Can you please unmute so we can hear you? Thank you.
Thank you, Rebecca. I don't have much information on it right now. I know we do need more legislative advocacy task force members off the board.
All right, thank you, Amy. Looks like there's a call for more folks to join the Legislative Advocacy Task Force Committee, and so that's something we can talk about internally. CNA Task Force, Abby, we just adopted that today. Do you have any follow-up? And also about the Policy Task Force?
Thanks, Melanie. No, that's all. Thank you all for approving today. We're working to get it translated and published for distribution. And for now, the work of the CNA task force is done, but I'll reach back out for help with distribution when it's ready. And I'll be sure to send you all the final report. As for the policy task force, the first meeting was on April 19th. We're currently working to revise the code of conduct to include behavioral expectations and information about ethical conduct. It's just in a preliminary stage of conversation now, but once we have a draft, we'll bring it to the CAAB for review and approval. And like Amy said, we need more volunteers to serve on the Legislative Advocacy Task Force. So if you're interested, please reach out to me over email. I highly encourage, especially new members or those who are not involved in other task forces, to sign up for engagement in this task force. And that's all I have.
Great, thank you. And since we do have some new members, are we accepting new members for the Policy Task Force that was just formed?
Yes, anyone is welcome to join task forces at any time. The CNA task force right now doesn't have any work to do, but for the other two ones, I definitely recommend joining.
Wonderful, thank you. So reach out to Abby if you're interested. All right, we have just a few minutes for open public forum. If there's any members from the public that would like to speak, now is your time.
Okay, so I just wanted to know, how do we apply for the pilot program? That's the tax dollars. And then that's not a grant, it's a program that is offered through the county, is that correct?
So, are you asking about the affordable housing sales tax dollars? That is all through City of Vancouver.
Okay.
So I recommend reaching out to Jamie. Actually wasn't sure who's running that program, but Jamie, if you can send us more information on that, that would be awesome. And if you're interested in county funding, we'll be opening up another round of requests for applications this fall, and that will be distributed to our distribution list, which seems like you're all on.
Yeah.
You're here today.
And then I just wanted to clarify that the EFSP is not for mortgage, it's for rental assistance. And so for individuals that are going to be evicted. So I just wanted to clarify that. And then what about funding for, utilities? Like, I know that we're not offering it, who's offering it? And I thought maybe this would be the best place to find out that information, because utility services, like, payments are not happening like citywide, and I don't know who's responsible, or who, you know, who has the funding for that.
Yeah, so a lot of our rental assistance providers also offer utility assistance with rental payments. And then we also have a contract with Clark Public Utilities to help provide energy assistance.
Oh, there is with the city, because we've contacted them before and they said there is no funding.
So through Clark Public Utilities, they do have funding for energy. It's through the Low Income Household Energy Assistance Program. And they are able to provide energy assistance funding.
Okay. Okay, that's it for me.
Any other members of the public? We have just a couple minutes left.
No.
Nothing in the room. Thanks, Melanie.
Okay. I don't see anyone online, so hearing no more questions or comments. We just want to remind you that May is Community Action Month, and there may be some activities to participate in, and I'm sure we'll hear about those from Abby. And Abby, can you speak more about the board communication procedures?
Yeah, so just to briefly touch on Community Action Month, just want to acknowledge this year marks 60 years of community action, and the National Community Action Partnership, or NCAP, has released their 2024 Community Action Month Toolkit. It's a really great resource if you're interested in engaging with community action or serving as an advocate this month. So I'll send that out to you all in the follow-up email. And yeah, on that note, if you're going to participate in any advocacy or community action event, I just want to really briefly remind everyone of our board communication procedures. So if you'd like to engage in public communication or advocacy using your CAAB position, which could include saying that you're advocating on behalf of the CAAB or signing an email as a CAAB representative, please make sure to first gain approval from the board. This could be done by a majority vote at a board meeting. You could also communicate with the executive team for approval. Or if you're advocating on behalf of a task force, you can get approval from the members of that task force. But it's really important that we're presenting as a unified front. And if messages are being communicated on behalf of the board, they need to reflect a board perspective or stance. So feel free to reach out to me if you have any questions or concerns about this. And then I also want to thank everyone who participated in the equity training last week. This is just the beginning of our work to further integrate the equity framework into the ongoing work of the CAAB. And I reached out over email about an opportunity for a follow-up discussion, since we didn't have time to get to the discussion questions during our training. And I've only received a couple responses to the poll so far, so I highly encourage you all to participate to reflect on the training and discuss how we can further integrate equity into the CAAB work moving forward. So I'll send that poll out again in the follow-up email, and I hope you all fill it out. And I'll follow up later with how we decide that we're gonna have more opportunity for equity discussions on the board.
Great. Thank you so much, Abby. Our next meeting is Wednesday, July 3rd from 9 to 10:30. So look forward to seeing some of you then, and take care, everyone. This meeting is adjourned.